We're here today to talk about cultural safety and Aboriginal communities and individuals in our region and how it affects our lives.
I think cultural safety is just a way to express being able to have who you are put forth so that you don't feel like you're being judged or taken apart by the outside communities. You feel like you're intact, not missing a vital piece of your personality. We are a people, we do have a culture, we do have a way of living, and that way of living isn't just some chapter in a history book. We're actually a living society that's continuing to evolve and adapt to our surroundings to ensure that our nations survive.
It doesn't necessarily need acknowledgement. You just know one another and you allow each other to be themselves. So it's nothing out of the ordinary when different cultures enter the room, enter the hospital. It's just a welcome feeling, and you know there's nothing to worry about.
For many years, I've come into these two hospitals with different family instances, and once my husband was here having open heart surgery, and he was having a heart attack. So I went to the nurse's station and I said, my husband doesn't have his nitro with him and I believe he's having a heart attack. And this nurse was rather brusque with me, and then I went back to the room to sit with my husband. And you can imagine sitting there thinking your husband's going to die any minute. So I went back there and sat at the end of the bed. And the nurse came minutes later. It seemed to take forever. And in our culture, we never leave our loved ones. If they're going to die, we're there with them till the end. And she said, would you please leave? I said, well, no, I'm going to sit here at the end of the bed. This is my husband. And she left. She didn't look after my husband. She left. Minutes later, 2 burly security men rushed into the room to escort me out.
A lot of the stories we've heard while we've been traveling around the island, talking to different people, different experiences they've had, traumatizing experiences. Michael, you spent time in the hospital during an illness. Is there anything that you learned about cultural safety while you were here?
Yeah, there was a few, like it's a little bit of a different, I come from a nursing family. Like you could say nursing probably afforded our whole family our well-being. Like my grandmother's a nurse all through the 40s and 50s. She went back to school to retrain to be an RN. And so she was a frontline spokesperson in a hospital she worked in. So my situation was a little different. But it's not different in the sense of nurses are your experience in the hospital. You see a doctor for about 5 minutes every week or 2 weeks when there's something definitive to happen. But your family and your care person and your lover and your friends, that's what the nurse's job is, to care for you now. So normally in that instance, when I got sick, my family was just like converged, right? My aunties were just like converged. And they were gonna be with me no matter what. And much to the nurse's delight, they wouldn't leave, you know? And part of, I think, cultural safety was the relationship that formed between those nurses and our family. By the time I got out, everybody was different to each other. I think cultural safety in a healthcare is sophisticating, allowing to keep the procedure that they need to keep, but widen their point of view on what family means.
Has anyone experienced a time where they had an elder or a family member who was very ill and they were near the end and they weren't given the opportunity to practice their traditions or their ceremonies?
I think Indigenous people have a different sense of mortality than other cultures. We sort of acknowledge that passing on time is a special time and we've got ways of dealing with it. Like I've just observed it. When my grandfather went home My aunts had to fight really hard just to keep him in his bed. And he stayed there for 8 hours because they didn't want to pull his body out of in an unnatural way. They wanted to, so we just sat around his, literally just, we sat around him until people came from Alert Bay to say goodbye.
We line the hospital rooms and hallways
Yeah.
to be with our loved ones at the end, and that's a bit much for the hospital sometimes.
I can see that being a bit much, but.
But that's the way we roll.
So, yeah.
And we also, you know, funny as this may seem, that's the way we roll, and we have a little bit of humor around death. I think that's the other part, is people don't quite understand us. They think they're anthropological specimens, but humor is how we say goodbye to our people, too.
When my father passed away, his body got brought to this hospital. And it took me and my 3 sisters and my mom and my father's 2 sisters that were able to make it to the island, like 3 days just to get access to our father, to say our goodbyes, to claim his stuff so that we can do our proper house it, send off for his belongings. If this society is trying to claim that they're more in tune with First Nations and people of ethnicity and their traditions and their cultures, well, why don't they use their actions to back up these words and show the rest of the world that yes, we are making headway.
People here in our circle who are entrenched in the system and work within the healthcare system. Would you like to comment at all, either of you, about what it's like to be Aboriginal and working within the hospital system?
I'm admin support, so I get to answer the phone and hear people's trauma. I get to hear people's anger. I get to hear people's sadness. I get to hear people's frustration. So for me, it is kind of, cultural safety is respect. Like, first of all, you respect the person on the other end of the phone. You respect the person you're talking to. You respect the person you're looking into their eyes. And for me, like, we're all professional and we're all people. So we need to be human first before we are professional. Like, we realize everybody went to school for 4 years and became a doctor and a nurse or whatever, but we were all human first, and we all start by saying, hi, how are you? My name is so-and-so. I'm from here. But now people fly into the office or fly into the patient's room and grab the chart and look and poke at you and do this and that. And they don't ask you, how are you? They don't ask you what your name is or where you come from. Like, for me, that's the big piece that's missing. We need to be human first.
That was echoed many, many, many times in the last couple weeks in interviews. Respect.
Because of our history, I think a lot of our people are really reluctant even to access and use any healthcare system, because they don't know what kind of, what they're going to deal with when they meet a doctor or the nurses, or how that hospital is going to treat them. And so when these kinds of things happen where there's a lot of insensitivity, it just further creates that wedge. And I know a lot of people who will not take care of their health just because they can't deal with having to go to the hospital or to see a doctor. So that's something else where I think this cultural safety is really important.
How do you bridge that knowledge of knowing that there's a fear and barriers into welcoming people and making them feel comfortable?
My experience has been more with all nations. It's hard. It's very hard, because a lot of the time too they'll assume I'm family when I'm actually the healthcare worker with the staff here, and they just assume I'm family all the time. Most times it's correct, because I tend to be related to a lot of people, but I think that again is about respect and finding out who you're dealing with and talking to, because a lot of the time you don't even know. The families themselves have a lot of rich knowledge. Like, for example, yesterday there's an elder in the hospital who is quite well respected and has a lot of knowledge, and so does her family. And it would, to me, in my mind, what she has would equal what a doctor has in their culture. And so I think there needs to be that equality amongst the elders and what they own and have and know, as well as what the doctors own and have and well and know. Like what he was saying earlier, it makes it whole, because it does. When that respect, when I see the nurse is respectful herself, it's just amazing what you can see happens for the patient. But when the nurse lacks respect, usually what that is about is her own self-respect. She doesn't know herself. She doesn't know where she comes from. She doesn't know her own background. If she doesn't feel comfortable with other people's culture, often she doesn't feel comfortable with her own.
So besides Aboriginal health, VIHA as a whole has also their strategic plan, right? And they are also in tune to wanting to improve the health of Aboriginals. So it's not just Aboriginal health in our plan, it's the whole of VIHA. So you're talking nurses, you're talking people who do the tests, you're talking about the x-ray people, you're talking about the lab people. So everybody that all Aboriginals come into contact with in hospital, they're told that we are the #1 priority. To increase our health is a priority for them as a whole. So it's not just Aboriginal health.
Yeah.
Like that's what people need to understand, that VIHA is like 17,000 staff. And a lot of them don't know the history. A lot of them don't know about residential schools. A lot of them don't know that, what happened there. But when our people come to this institution, that's what they are reminded of. And when we see people in authoritative positions like doctors, nurses, security, we tend to fall back and put up the old "stay away from me" sign. And that's what needs to change.
I think we need to keep remembering that the state of our health before colonization was probably the best in the world.
That's right.
Because and it wasn't just a random thing that happened to us. It was very, very with a sound knowledge of our surroundings and what made us healthy. And I think we have to keep reinforcing that. And I also really, there's this other part, we're in a dominant society because we've been colonized. And I think that there's this inequality, this lack of balance. And I just know that we have indigenous psychology, we have indigenous healing, that is something that has worth. And when this society realizes that they're not the only culture on this continent, that they need to start looking at how they can start working together with other cultures.
Contemporary lifestyle does not fit the indigenous genetics. That's why we're in the hospital. And then before contemporary lifestyle, we all lived on some of the most high quality foods on the planet and never ending amounts of it. So our genetics are hardwired for those things. So we start pumping it full of things that are from contemporary lifestyle, and there's adverse effect. We end up in the hospital.
Well, certainly a lot of good things said today, and some of the things reminded me of some of my experiences that I've had, and most of the time it's for something I have to go to emergency or something, and I think that's probably where most of people have contact with hospitals. But one thing I really noticed was that when you go to the emergency to be looked at, or you need to see a doctor, that it's really crowded in there. There's lots and lots of people, and I know how it is like that. But I always feel like everybody else is getting served first, and you're the last one always. Even you're sitting there by yourself, the whole place could be empty, and you're still sitting there yet waiting. And then after a while, somebody comes out and sees you, and it's like they only came out to see you because they had to. And I think that I don't know. I feel a little segregated, I guess.
Now, one way VIHA is hoping to make the hospital environment more healing and more welcoming is starting all nations healing rooms, and there's a new one at Royal Jubilee Patient Center, and there's one planned for every hospital that's being built on the island. Do you want to share anything about that?
It's her baby.
That would be my baby. Yes, VIHA has built a room in the new patient care center where Aboriginals, we will be able to perform our cultural ceremonies and practices in that room. So that means we will be able to smudge, we will be able to cleanse ourselves with water, we will be able to cleanse ourselves with candles as the Shaker Church people do. And this room is equipped with a special fan. So when we are in there performing our cultural practices, we turn on the fan and the smoke will be evacuated. VIHA's listened to the elders spoke and VIHA listened, so yay, it's like a miracle. It is a miracle because this is the first of its kind. There are a couple in, like, I think there's one in Port Hardy and there's one in Campbell River, but this one here in Victoria is the only one equipped with the special ventilation. So we will be able to burn in there, which is absolutely fabulous.
Yeah, because you can bring your family member
Yeah.
in there.
And
In
we'll
the
also,
room.
the room is
From
built-
the other rooms.
Yeah, the room is specially made with 2 different exits and entrances so that if there's a family member in hospital who wants to perform cultural practices, we can then have a porter bring the patient down into the room through their own private entrance. So the patient will not be brought through the hospital under everybody's eyes. So, which is also good.
Wow.
So this room, the elders wanted it to resemble like a big house, to resemble like home. So they wanted a beach log, they wanted beach benches, they wanted totems, they wanted the room to look like a big house. So VIHA and the engineers have done their best to make that possible.
And
So
they're Coast Salish carvers.
there will be totem poles outside the room. They are being carved right now by 2 Coast Salish carvers, Doug LaFortune and Charles Elliott. So we did do the groundwork and get Coast Salish carvers in here because we are on Coast Salish land. So, yeah.
Great!
Nina.
That's a big step, big
Yeah.
step. It's like the university's getting First People's houses. It means so much to the students, so it can only mean so much to the patients and their families. Well, I want to thank you all for sharing. It's sometimes hard to share stories that hurt and have
Yes.
a lot of emotion and are still on the surface, but by sharing, I hope that we can teach the people that we're speaking to. So thank you very much.